My name is healani Taitague Laforga. I'm currently a public health student. I'm specializing in Native Hawaiian Indigenous health and graduating this semester, so I'm super excited. But I am from Mililani, and I am also, well, my activity that I resonate most with, my physical activity is hula. I've been dancing since I was 5 years old and have really really appreciated hula as a treasure and gift in my life. But super amazing work that you guys done. Round of applause. I was hearing Mele's applause and I thought it was so funny because yes, you guys did amazing. Love the research, but some of the key themes that I kind of resonated with was, and it actually was spoke by Mele in the chat, was for Simone, for your spirituality and interweaving that into your research. It's so important. My capstone project was on exploring the perceptions of Vai among Indigenous people of Moana Nui Akea. And one of the big themes that I identified was the inherent mana, or the inherent spiritual power of Kane, or the waters of Kane, for Kanako Iwi or Native Hawaiians. And really loved how you weave that in and prioritize that as a part of your project. But I also saw it in Rachel's project of Lo'ikalo, but when she spoke about the Aio being back on the Lo'i, yes, so exciting. I remember when I went to Kako'o Iwi, Lo'ikalo and Heia, and Uncle Vernon, who was our guide during that time, spoke about pointed out the IO especially, and told us how when you see IO, that's how you know your kupuna are happy with the spaces that are being restored. So I love that you really are seeing and observing these things and our kupuna around, and seeing that your work is really showcased and reflected and loved by our kupuna right now. So very excited about that work. And then lastly, David, I really loved that theme of that equity theme, and seeing that we want these coastal spaces to be accessible physically and culturally for everyone. And I really appreciate your work for climate resilience as we're trying to address these issues, but in a culturally relevant and also accessible way for everyone. So really excited about your work. And the last thing that I really want to say that everyone had that was interweaved and that I'm super excited about as a public healther, is just prioritizing community. I know both you, Simone and Rachel, talked about how you're doing work in Hawaii, but you're not from Hawaii, you're not Kanaka, but you are under mentorship by Mele, or you're under mentorship by others who really are hamas in these communities and really know our communities and our Kanaka. So I'm super excited and happy that you guys are guided by these people and really integrating that community focus, but not integrating, but prioritizing it. Love to collaborate if anyone would like to. Yes, but mahalo